Okay, so what we're doing today is we're treating axillary hyperhidrosis, which is the medical term for excessive underarm sweating. And it's a very common condition that affects both men and ladies, often from adolescence onwards. This patient is being treated with botulinum toxin injections, and it's a really safe and effective treatment option for excessive sweating, which has really now preferred over the older treatment options like topical antiperspirants or medications, because it doesn't have any of the side effects of those treatments. Now, these injections work by blocking a chemical signal called acetylcholine, which is a chemical messenger, and that chemical messenger tells your sweat glands to basically produce sweat. So when we block that chemical signal, you can get a complete reduction and sometimes cessation of sweating for up to 4 months' time. So how it's performed is a patient will have an ice pack applied for about 15 minutes, and that provides a really good numbing effect. And the treatment is very well tolerated and is minimal discomfort. Then the axilla is marked out. The whole axillary vault is marked out where the sweat glands come out. And we do about between 20 or 30 little tiny injections over the whole of the underarm. We want them to be as shallow in the skin as possible, because that's where the sweat glands sit, and that's when that results in an effective reduction in sweating. Usually the onset comes on about by day 3, and the maximal effect is at about day 7, and the lack of sweating lasts for about up to 4 months. But with repeat injections, patients can report that they have no sweating for up to 5 or 6 months. So the area's been cleaned, and now we're just going to do lots of tiny little injections, all spaced about 1 centimetre and 1 centimetre apart. And you can see here that we're getting little blebs under the skin. We want those little blebs, because that means the botulinum toxin is being placed exactly where you want it, which is really, really shallow where the sweat glands sit. And you can see that it's a very well tolerated procedure. Only takes about 15 minutes. So it's convenient for patients, in and out, and only coming back every 4 to 6 months. And how are you going there?
Yeah, good.
Good.